Now that we've mastered the basics, we're going to move on to some exercises that help you challenge your pelvic floor. We're going to try and keep your pelvic floor connected as you move, and this is often when leaks occur. Repeat each exercise 10 times on each side, and if you find one exercise particularly difficult or one side particularly difficult, then practice that more each week, as this may be the key to where you lose your pelvic floor. Start lying down on your back with your head relaxed, shoulders relaxed, and your feet and knees parallel. Then balance your pelvic bowl, tipping the pelvis forward so you feel like you're arching your lower back, and tip the pelvis backwards so you feel like your back is touching the floor. Then come to that center point where we can feel your pubic bone and hip bones are level, and there's a small space behind your lower back. From here, breathe in through your nose, relaxing your rib cage and shoulders, and as you breathe out, lift your pelvic floor. Keep it lifted as you open your right leg to the side. Just go as far as you can control. Inhale and return. Exhale, pelvic floor and left side. We're trying to keep that pelvis nice and still. Inhale and return. Exhale, lift the pelvic floor and open to the side. Inhale and return. Repeat on the opposite side. At first, this movement should start off pretty small, but as you get better, the leg will move out further and further, just so long as you're maintaining that pelvis nice and level. Inhale and return. Now we're going to move into leg float. Balance your pelvic bowl, relaxing your shoulders and your rib cage as you breathe in. Breath in. As you breathe out, lift your pelvic floor and float your right foot up off the ground to there. Inhale and hold. Exhale and return. Nothing else is moving, just that leg. Breath in to hold. Breath out, pelvic floor and leg. Inhale. Exhale, return. Making sure you don't fold your spine into the floor. Keep that balance in the pelvic bowl. Breath in to hold. Exhale, float the right foot. Inhale and hold, and exhale, return. Now we're going to challenge the arms. Same setup, balance your pelvic bowl, soften your rib cage and relax your head. Now we're going to breathe in. Pelvic floor lifts as you float your arms up above your head. Inhale, hold. Exhale, return. Inhale, hold. Balance that pelvic bowl. Exhale, pelvic floor and float. Inhale, hold. Exhale, pelvic floor and return. Now on your hands and knees, bring your shoulders over your hands and your knees underneath your hips. Make sure that your knees are hip width apart and balance your pelvic bowl. Tip it forwards and backwards and then settle into that mid position, which will again keep that spine nice and long. Lengthen the back of the head out, away from your spine. And from here we're going to move our legs. Breath in to prepare. Breath out, pelvic floor, nothing moves except that left leg slides out along the floor. Keep it in contact at the floor to begin with. Inhale and return. Exhale, pelvic floor and slide your right leg. Inhale and return. As you're moving, you're really trying to make sure that you keep that pelvic floor lifted. And as best you can, keep your spine still. Lovely. Now we're going to move to the arms. Same position. Making sure your shoulders stay nice and wide and your collarbones a little lifted. From here, breath in to prepare, and as you breathe out, lift that pelvic floor. Keep it on as you float your right arm up towards your ear. Inhale and return. Exhale, float your left arm with your pelvic floor lifted. Inhale and return. As we're doing this, we're really keeping sure that our spine is staying still. No harbour bridges or harbour tunnels, and no shifting of that rib cage. And making sure you keep the pelvic floor lifted through the whole movement and don't hold your breath. You can start with little movements here and get bigger as you get more confident. Now we're going to move to sit to stand. This is something we do many times throughout the day, and it's the same movement as bending and lifting. Firstly, come into good sitting posture, balance your pelvic bowl, bring your rib cage in line with your pubic bone, and float the back of the head up towards the ceiling. Bring your feet back behind your knees. Inhale, relax your shoulders. Exhale, and as you lift your pelvic floor strongly, tip forward at the tailbone, peeling your bottom off the chair. Inhale and hold, and as you exhale, lift your pelvic floor up and push through your heels into standing. Inhale, hold here, and exhale, pelvic floor lifts, tip your tailbone back behind you. Inhale and hold, exhale and lower to the chair. Inhale and return. Exhale, lift your pelvic floor and tip forward. Inhale and hold. Exhale, push your weight through your heels to come up into standing. Trying to keep that pelvic floor switched on the whole movement. Don't forget that if you're having trouble seeing progress, please consider seeing a women's health physiotherapist for an individual program. These exercises may be challenging, but they shouldn't cause any pain.